is Mr. Jim Pankovich, Vice President, Clinical Operations and Drug Development at QBeCO. Mr. Pankovich has more than 20 years' experience in biopharmaceutical industry with extensive strategy management, clinical study management, and operational experience. During his career, he has guided the development of novel compounds and biologics for the treatment of various cancers and infectious disease in all phases of clinical development, from concept to NDA filing. Most recently, he served as the Chief Scientific Officer of the CIHR Canadian HIV Trials Network. He was formerly the Senior Director, Clinical Research for Mygenex Inc., Associate Director, Clinical Research at INEX Pharmaceuticals, and Vice President, Operations and Clinical Research at CV Technologies. Mr. Pankovich holds a Master of Science in Experimental Medicine from the University of Alberta and a Master of Business Administration from Queen's University. Without further ado, Mr. Jim Pankovich.
Thank you very much, Bonnie, and welcome to everyone to our webinar today. We look forward to the presentation as well as the questions and answer session at the end of the session. Just a little bit of an outline of what the webinar will cover today. We'll introduce you to QBeLogics and our technology, QBECO site-specific immunomodulation. We'll talk a little bit about the study details for our upcoming clinical trials in patients with Crohn's disease. We'll describe some of the study activities that participants will be asked to participate in. We'll talk about some of the enrollment details and some of the inclusion and exclusion criteria for participation in this trial. And then we'll have some special guests that will help us understand what it's like to participate in a clinical trial, and the Q's clinical trial in particular, with two past participants providing insight into that, followed by a question and answer session. As Bonnie had said, we'll endeavor to answer as many questions as we can during the allotted time. So a little bit about our technology. The technology that the QBeLogics is developing is called QBECO SSI for site-specific immune modulation. It's derived from inactivated bacteria, and really our goal is to use this product to stimulate the innate immune system response in the gut, which is our targeted organ and the organ of interest for IBD. QBECO is actually administered subcutaneously every second day, and will be administered by the participants in the study at home while they participate in the trial. A little bit about our previous data. We have completed 2 prior clinical trials, one in Crohn's disease and one in ulcerative colitis. The data on this slide really represents some of the key data that came out of our QBECO Crohn's disease trial. The previous trial, QBECO CD01, was a 68-patient randomized controlled trial, which means that half the patients received QBECO and half the patients received placebo. It was in Crohn's disease patients that had moderate to severe disease. Again, subjects were asked to self-administer a subcutaneous injection of QBECO or placebo every second day for up to 16 weeks during the trial participation. As you see in this slide, we actually looked at the data and the outcome of the patients that actually participated in the study over 2 different treatment periods. You'll see along the bottom of the graph, you'll see the treatment time frame from baseline, which is the start of the study, through week 8, which was our first evaluation time point, and then through week 16, which was our second evaluation time point during the study. You'll also see the 2 groups that are identified there that did participate in the study. The first was those in the blue line that had placebo. And you'll see that they got a slight decrease in their Crohn's Disease Activity Index score, but not to the same magnitude as we saw with the QBECO-treated patients in the red line. And you'll see that those that were treated with QBECO had a larger overall mean or average response during the first 8-week treatment period. You'll also see in the graph that as patients that continued on beyond the week 8 treatment period into the second evaluation period at week 16, those patients that participated continued to respond. And we see this as a continued therapy, and we've adopted this into our next clinical trial in that our evaluation time points will be a little bit longer because we believe, based on this data, that potentially we need to treat longer to get optimal outcomes. A little bit about the safety data. So in conjunction with getting outcome data that talks to us about the efficacy or the outcomes, we also want to be able to capture some safety data so we can actually evaluate that during the course of our previous trials as well as for our upcoming study. Overall, in our previous 2 clinical trials, both with Crohn's and ulcerative colitis, we found that the product was well tolerated by all those participants in the study. There were no dose-limiting toxicities at any of the doses that have been used to date in either of our previous clinical trials. And nearly all of the reported adverse events were mild or moderate in terms of the severity. Most of the adverse events that did occur were related to early time points in the study administration, and as patients became more familiar or as patients continued on throughout the course of the treatment, the adverse events tended to get milder or disappeared. Some of the most frequently reported adverse events that we did see and did expect as we went through the clinical trial were injection site reactions. Patients can receive, they don't have to, but they can receive injection site reactions, which can be redness and swelling at the site of injection. They can also experience what is called flu-like symptoms, where they can get chills and aches. And again, both of these symptoms tended to go away as the participants continued out throughout the clinical trial. With this, they could also experience transient fever that could last 12 to 24 hours after an injection. Together with this, some nausea and some fatigue, again, that tended to go away as the trial participants continued throughout the treatment period. These were the most frequent reported symptoms or adverse events that happened in our previous clinical trials. Now, our next clinical trial, as Bonnie had mentioned at the beginning, is called RESTORE. And this trial is an important next step for the development of our QBECO SSI program. There are some important differences and some important things that we've incorporated into this trial that we learned in our previous clinical trials, and we'll talk to them in a moment. The aim of this trial is really to understand, again, some of the clinical remission data. How long does it take for a patient who's getting treated on QBECO SSI to get into clinical remission or resolution of symptoms? We also want to look at, for the first time in our Crohn's disease patients, looking at their colonoscopies and look at the endoscopic healing that we can actually observe in patients taking QBECO SSI. This will be both of these will be important endpoints for the clinical trial, as well as the safety and tolerability of those taking the product throughout the clinical trial. Our next study is really divided into 2 stages. The first stage, which is the stage of the study that will be starting very shortly and actually will be up and running in Canada, stage 1, will be enrolling 20 patients. This will actually be an open label study, which means that all participants in the study will be receiving QBECO SSI. Study participants will be asked to go through a screening procedure, which includes medical history as well as endoscopic and symptom evaluations at the beginning or screening period. If they meet the eligibility criteria for the trial, participants will be enrolled into the clinical trial and will be taking QBECO SSI every second day for the duration of the period. The first evaluation time point will be after 16 weeks of treatment, in which patients will be then asked to have another colonoscopy and will evaluate their symptoms at that same time. With that, patients then will continue on treatment for an additional 10 weeks, in which there'll be another endoscopic evaluation, as well as evaluation of clinical symptoms at that time. Patients that have deemed to have a response either through symptom relief or through endoscopic evaluations will then be eligible to continue on treatment, again, every second day for up to 52 weeks, at which point there'll be another evaluation for the ability to be able to maintain their response over that 6-month period. Patients at week 52 will be asked to have another colonoscopy, as well as the evaluation of their clinical symptoms. Patients then will be, at week 52, will end the treatment portion of the study and will be followed for 4 weeks for a safety evaluation and final evaluation, which would then lead to a study end. The important part of this study is really to help us understand how long we need to treat to get optimal symptom relief as well as endoscopic improvements. Once we learn this information in those first 20 study participants, we'll apply that time point to our next stage 2 of the clinical trial, which is anticipated to start next year. The stage 1 study will include 20 study participants recruited at clinical trial sites across Canada. At this point, we have 4 clinical trial sites: Vancouver, New Westminster, which is a suburb of Vancouver, Vernon, BC, and in Hamilton. These sites will be up and running and be able to accept patients starting from now over the next month, and we'll roll out our recruitment as the sites become open and eligible to receive patients. During the course of the trial, over that 52 weeks, subjects or participants will be asked to attend 10 in-person clinic visits, as well as participate in 3 remote visits that will be done by telephone with the study personnel at the clinical trial sites. These include, as you see there, at the very beginning, during the week 1 evaluation, to be able to do the screening, as well as the teaching and training of how to self-administer the product. Then for safety visits at week 4 and week 8, participants will be asked to return to the clinic. And then at week 16 and 26 will be those evaluation time points, where participants will be asked to have colonoscopies and the evaluation of their clinical symptoms will be performed. Those that continue on into the later part of the maintenance phase of the clinical study will then have in-person visits at week 40 for a safety evaluation, and then at week 52 for their final outcome evaluation, including both a colonoscopy and clinical symptoms. During this time, the study drug, test fees, and study-related travel will be paid for by the sponsor, which is QBeCos. During this time, we'll also be collecting blood samples for various analyses during the course of the 52 weeks. This will include blood samples to look at very specific immunological biomarkers, which can tell us a lot about how a patient is responding, or how we can actually potentially optimize our treatment as we move forward in the development of the program. We'll be looking at stool and urine samples. We'll be collecting samples where we'll be looking at fecal calprotectin or C-reactive protein to evaluate the GI inflammation. We'll be doing a microbiome analysis to see how the treatment and the overall treatment may affect your microbiome in your GI tract. We'll be taking biopsy samples at the same time points as the colonoscopies, and we'll be performing physical examinations just to have as part of our safety evaluation. We will also be conducting a genetic sub-study in which we'll be asking participants to supply us with a blood sample in which we can look at IBD-related genetics and see if there's any correlation with the outcome of the QBECO treatment. We'll also be looking at collecting blood samples to see how different immune cells within your blood may actually interact with QBECO in a stimulation assay. So the administration, as we had talked about, is during this stage 1, there is no placebo. All 20 participants will receive QBECO SSI administered every 2nd day through subcutaneous injection. The product will be self-administered at home by the study participants. And the injection, as you see there on this slide, you can see the vial and you can see the syringe. So study participants will be trained how to self-administer the product, and then they'll take the study materials home with them, and during the course of the treatment period, self-administer the product every 2nd day. The subcutaneous injections can be given at various points in the body. but primarily will be the abdomen or the left or right thigh, which is how we had actually administered the product in previous clinical trials. Some of the preliminary or some of the eligibility criteria for this stage 1 of the clinical trial. Here's a short list of some of the main eligibility criteria. As potential study participants are either talking with our research nurse or at the clinical trial site going through the evaluation criteria, the study coordinators will actually go through a much more extensive list of the criteria. But here are some of the high-level criteria. To be eligible for the trial, you must be at least 18 years of age. You must have Crohn's disease for at least 3 months. Your Crohn's disease must be defined as moderate to severe disease based on both endoscopic or based on either endoscopic and or clinical symptoms at the time of evaluation. And you must be willing to follow contraceptive guidelines during the course of the treatment period. Some of the ineligibility criteria is if you've had biologics in the prior 60 days. So this is one of the criteria, although we have a 30-day screening window, so that's something to keep in mind. Or if you're going to require or anticipate requiring major surgical intervention during the treatment period. We'll also exclude potential participants that would be experiencing active infection at the screening period or during the early part of the clinical trial. Now, if you're interested or if you know of somebody that may be interested or may be eligible for this clinical trial, there are a couple ways to interact with or to get additional information about the clinical trial. One of the easiest is to actually go to the restoretrial.ca website, in which we have a pre-screening questionnaire. And the questionnaire will have a small number of questions in which you will be asked to complete some information. And upon completion of that information, the information will be sent to our pre-screening clinical trial nurse. Andrea Cameron will be the one that will be following up with you based on the material or the questions or the answers to the questions that we've given in the questionnaire. And she'll be the one that will be following up with you and asking questions. So I'd like to introduce you to Andrea Cameron, who will be the clinical trial pre-screening nurse for this study.
Good afternoon, everyone. As Jim has said, my name is Andrea. I am a registered nurse. I have been working in clinical research for the past 12 years in the areas of cardiology and endocrinology. I am pleased to work with the QBECO team on the RESTORE study. My role is to be a contact and resource for people with Crohn's disease who would like to find out more about this study or who have general questions about what is involved in participating in a research study. I will also be available for ongoing support for study inquirers and study participants. For those interested in participating, I will be conducting pre-screening assessments for study eligibility via phone and will refer eligible patients to a study site in their local area if there is one available. Final study eligibility will be confirmed at the local study sites after clinical assessments have been completed. I can be reached via email or phone using the contact information that we will have on the screen, and I'm looking forward to hearing from you.
Thank you very much, Andrea, and I look forward to you speaking with potential participants as we go through this clinical trial. Next up, we have a couple of special guests that I will give them an introduction, but then ask them to introduce themselves as they come on the line. Christine and Patrick are both former clinical trial participants in our QBECO CD01 study, or our previous Crohn's disease clinical trial. We've asked them today to share some of their experiences participating in this trial, which took place between 2013 and 2016. They'll share some of the experiences. We'll have some question and answers with them during this call, but they'll also be available if you have any questions specifically for them during our question and answer session following their short presentation. So I'd like to, first of all, introduce them to you, and I'll ask each one of them to introduce themselves. So maybe we'll start with Christine. Christine, could you introduce yourself and provide a little background about your participation in clinical trial?
Yes, thank you. I'm Christine, and I'm 48 years old, and I began with symptoms of Crohn's disease when I was about 15, and it went undiagnosed till I was 26. When I was 26, it was diagnosed through surgery. I had emergency surgery. I have active Crohn's disease in my duodenum and my distal ilia. That's at first where it first propped up. So they were, at first, the physicians were unclear as to what was happening, and they thought perhaps I had an ulcer at 26. And they treated me for that. I was really sick at home, and by the time they had surgery, I was quite thin and quite sick and quite desperate, actually. And then when I had woke from that, I was informed that I had Crohn's disease. So that began treatment, mostly with nonsteroidal anti-inflammatories over the next 20 years or so, which I had my moments where I had to go on prednisone a couple times throughout that time and just kind of stumbled through and tried to manage things until about 4 years ago, when my Crohn's disease became more active and cropped up more distally, and I began to have symptoms right in my rectum with bleeding and lost a lot of weight, flu-like symptoms, and finally came to a peak where I had a bad infection accompanying that bleeding and treated with prednisone. It was at that point that I knew my next step was probably immune suppressants. And so it was through trying to arm myself with all the information and about going on those drugs that I came across Dr. Helgun and the QBECO, and it made a lot of sense to me, the science behind it, stimulating your immune system. And so I became a participant in the trial, and it was a fabulous experience for me. By week 9, it was like someone flicked a light switch, and my symptoms just stopped. I had solid bowel movements. My iron issues that I've always struggled with and have to get monthly iron infusions. My iron was holding. I could go every 6 months perhaps before I had to have an infusion. And yes, so it was a great experience for me, and that brings me to this point here.
Well, thank you very much, Christine. Patrick, maybe I'll turn it over to you to introduce yourself as well.
Hi, I'm Patrick, and I'm 31, and been dealing with Crohn's disease for almost 15 years now. Spent some time on Remicade, but after about 9 years of taking that, I experienced some side effects from it, so I stopped. And the symptoms came back, and I was getting ready for a resection surgery when I started looking at my options and found QBECO on Google and signed up, and it worked out. It helped me with my Crohn's disease, and I still haven't had to get that resection. I guess that's about it for me.
Thank you very much, Patrick. And both of them had participated in our previous clinical trial. I do have a couple of questions that I'll ask each of them to respond to, just to provide some insight into their participation in the last clinical trial. So first, maybe I'll start with you, Patrick. When and how long did you take QBECO during your participation in the clinical trial?
I think it was about 6 months that I took it in 2014.
And Christine, how about yourself? Same question?
I was part of the trial where, well, I don't know where the 16 weeks is, but it was a full 16 weeks that I had been on QBECO.
Okay, thank you. What was it like, maybe Christine, I'll ask this question to you first. What was it like to take the study drug every second day?
I must admit at first, the thought of it was odd to give. I mean, no one likes needles, and so that's the first thing you think of. It's a needle. I'm giving myself a needle. So I was a bit apprehensive about it at first, but I just thought to myself, there's a lot of people that do this all the time in terms of insulin injections, and it's quite manageable, and I had known a few friends that dealt with that kind of stuff before, so it was fine. And really, after the first injection you were shown about it, it really became quite routine. It wasn't that big of a deal to fit into my life. It was quite reasonable.
And Patrick, same question. What did you find, or how did you find taking this study drug administration every second day?
It was painless. I was on Remicade before, so I was used to the infusions. So in comparison, having just having to put this tiny little needle in your skin was very easy. Honestly, I've had mosquitoes that were more painful.
Okay, and then maybe Christine, this question. Is there anything that during your participation or what you learned as participating in a clinical trial that you'd want to share with the other people that are on the webinar today?
Not really. I think I'm not sure if this is the right answer to your question, but it was helpful for me just to, I immersed myself in it. I made sure that I followed all the timing and filled out the diaries. I'm not sure if you have a diary this time of what you're doing, but and I just had that routine. I put it into the routine of my life because we're all really busy, and I found I did the injections the same time every day, and I filled out the diary every evening before I went to bed. It just stayed by my bedside, and it, like I said, it just made it really easy to fit into my life.
And Patrick, maybe the same question to you. Is there anything you'd like to share about participating in what I think was your first clinical trial for the study participants on the line?
Mm-hmm.
Sorry, what was the question?
So is there anything you'd like to share about your participation in this clinical trial, which I believe was your first clinical trial that you'd participated in, about the other people that may be thinking about participating?
Yeah, I mean, it was very easy. You guys kept on top of me and made sure I filled out all the paperwork and showed up to my appointments. It was better care than I've ever received from any of my other care providers. I really appreciated it.
Okay, well, thank you. Both Christine and Patrick will be on the line and will be available during our question and answer session. So I would like to thank you. I would like to thank all the participants today for their contribution to our webinar. I'll turn it over to Bonnie to start the question and answer session.
Okay, everyone. Now's the time you can send in your questions via chat. If you have questions you'd like directed to any of our guests, either our clinical trial recruitment nurse or either of our former participants, please indicate their name, or if you don't remember their name, just say nurse or participant. So when you type your question, that way we can direct them to the people and answer as many as we can.
Well, thank you, Bonnie. We do have the first question that's come in for both Christine and Patrick. So the question was, do you have any Crohn's symptoms at this time? So maybe Patrick, I'll have you start, and then once he's finished, Christine.
Yeah, my Crohn's symptoms have returned, but the study helped me understand my Crohn's disease in a different way, I suppose, because in the past, the immunosuppressants that I was on caused healing to happen first, and digestive function didn't necessarily get restored. So I still had bathroom issues. But with the Q drug, I initially actually experienced quite a bit of pain on the drug because my digestive system was fixing itself, I guess, and because of my active Crohn's disease, it was really painful to get harder stools. So once the healing happened and everything was back in a balance, I guess I came to understand that sometimes a little bit of pain is necessary to deal with this disease. And so right now I've been trying things like probiotics, and in the past I wouldn't because they would cause me gut ache, and now I've kind of worked through it, and I've noticed that that necessarily wasn't a bad thing.
Okay, Christine, the same question to you.
I do have symptoms. Some of my symptoms have come back, and they came back, probably it took a year and a half. Just to clarify, I always was on non-steroidal anti-inflammatories, both orally and suppositories for my rectal bleeding. And I did have a colonoscopy to identify that I did have healing and that there was no inflammation, probably a year after I had completed the trial, and I still felt great. And it was interesting because within 6 months after that, so a year and a half after I had completed the trial, I began to have bleeding again. But the symptoms that I had of my upper GI tract haven't really come back yet. It's just been the lower distal one, which the onset of was most recent, within the last 4 or 5 years. But just to be clear, it hasn't been as bad as it was. I was very sick when I started taking the QBECO, and it, like I was saying before, it took I was on it for 8 weeks. I actually thought maybe I just had the placebo at the time because I just felt sicker and sicker and sicker. But 9th week, it just, maybe it was, I never thought about it before, but maybe it was the same kind of stuff that was happening with Patrick. I'm not sure. I'm just guessing. But so yes, it has come back, but not to the extent that it was. And probiotics do help me, yes.
Okay. So another question then is about the anticipate being able to accept Alberta patients at the Vancouver trial site. So maybe I'll start the answer with that. So we're working as we start to get our clinical trial sites up and running, and in particular with our Vancouver area clinical trial site, we will work with them to determine if they have the capacity to accept patients from outside of the British Columbia, and we will, Andrea will know that information as we go through that process. So we're going to try and accommodate as many patients as possible. I guess another question that's come in for Patrick and Christine is, do either of you take any drugs now? Maybe Christine, we'll start with you.
Sure, I do. I take Mesavant. I think it's the full 4.6 grams or whatever it is, and I take that once a day, and Salafalk, the anal suppository, once every night. I take that. And I'm very sensitive to the suppository. Even if I try to skip it every other day for a few days in a row, I'll start getting symptoms again of either bleeding or looseness, that kind of thing. And I've taken those drugs for a long time now.
And Patrick, same question to you about taking any other drugs now?
Yeah, right now I recently started experimenting with LDN, low-dose naltrexone, and I've been on cannabis for a while. Right now I'm looking at, I guess, things that will help stimulate the existing immune system like the Q drug does, rather than trying to suppress it. My gastroenterologist has been suggesting some of the newer immunosuppressants, but I think that is soon to be an old-fashioned way of treating Crohn's. I think trying to help stimulate the immune system is the way forward with this. It makes a lot of sense to me. And I've been trying to adjust my diet to help the existing immune system survive and have eliminated dairy, gluten, and reduced sugar. Been making a lot of kombucha and eating a lot of probiotics.
And that leads us right into the next question for you, Patrick. Have you altered your diet at or before or during or since the trial in terms of dairy, gluten, sugar, any alterations to your diet?
Yeah, I've made a lot of changes. You can't. There's no bad advice I found out there. You can find 100 websites and suggestions on what to do, and they're all sort of and pointing you in the same direction, which is to eat healthier and reduce refined foods. And I found all that makes a big difference. Yeah.
So a question about the SSI product itself, and I'll probably share the answer with Andrea in terms of answering these questions. The first is the SSI the same as a vaccine? So maybe I'll take a start and then Andrea can actually jump in. So with the QBECO SSI, the goal is to stimulate the immune system, which is similar to what a vaccine does. With our product, though, we're actually looking at stimulating a different part of the immune system, which is really the innate immune system, or different types of cells in your body that will respond to in your mucosa or in your gut a little bit differently than a vaccine itself. But the overall idea is very similar in terms of stimulating the immune system. It just, with our product, will stimulate a different part of the immune system.
Yeah, that's right. So when you get a vaccine, we're actually stimulating the immune system to create antibodies, or we're actually giving the immune system antibodies. So with the QBECO, we're actually stimulating the immune cells that are responsible for preserving the integrity of the intestinal mucosa, with the idea being that if with an intact mucosa, the invading bacteria cannot come in and cause the Crohn's flare-up.
And that kind of leads right into the next question, is about how it can possibly have an effect on the microbiome. And so the idea is that by stimulating the innate immune system will help to correct some of the pathology at the mucosal level, and at that point be able to then help the body really restore some of their microbiome, because no longer will there be some of the ulcerations that are there.
Yep, I think that answers it, unless there's more clarification needed.
And then the third question in that is, when do you anticipate the studies will be finalized and the product will be available commercially? So that's a very good question. It's also a bit of a difficult question to answer at this time, as we're an important part of the process. Developing a new drug for any disease actually takes time, and takes both scientific evidence as well as participation by study participants to go through clinical trials like this to help us understand how the product can be advantageous to patients, but also to help us understand some of the safety aspects of the product. So this trial itself is the 20-patient as well as the 150-patient main study are an important aspect of our development program. We're anticipating that when this trial is finished, we'll then move into a later stage of development. So the product itself is probably still several years away from being commercially available. We did have a question to Patrick about his use of cannabis. So have you had a scope since starting cannabis, and did it show any healing?
I have, and I wouldn't attribute any healing to cannabis. I mainly use cannabis for my Crohn's symptoms, like appetite stimulation, and when I have really bad pain. I haven't seen any healing from it.
A question about the second larger trial, the 150-patient Canada-US study. There will be in that trial 150 patients enrolled in that portion of the clinical trial. It will be a randomized placebo-controlled study in which 100 patients will receive QBECO SSI and 50 patients will receive placebo. We anticipate that those participants that are on placebo during that study will have at some point the ability to get QBECO once they've completed their contribution to the clinical study, but we still have to roll that portion out. The 150-patient study won't start until at the earliest early next year, so we'll have additional information about that as we continue forward in the development program. So there was a question about both Patrick and Christine have had Crohn's symptoms reoccur since taking or since their participation in the clinical trial. Are there any patients that have remained in remission? So that's a good question as well. Anecdotally, or in some of the compassionate use, there were patients that compassionate use that had preceded our clinical trial. There were a couple of patients that had maintained remission after completing. But we have not completed those clinical trials to show how long patients can maintain their remission following the stopping of the treatment of QBECO SSI. So that is one of the trials that we will do in the future, is to try and determine how long that remission, whether it be endoscopic remission or symptom relief, how long that can be maintained. And that'll be an important part of this clinical trial, as well as an additional clinical trials that we'll do in the future. So there's a question about, do we get better response from participants who've never been on anti-TNF-alpha and who have failed or have failed anti-TNF-alpha biologics? So that's a good question. In our previous trial, we had both, those that had prior TNF-alpha therapy and those that had failed prior TNF-alpha, those that were naive to TNF-alpha and those that had failed prior TNF-alpha therapy. And we did see those patients that had never taken TNF-alpha therapy did respond faster and did respond better than those that had prior biologic therapy. Again, in this trial, we're actually going to be enrolling both participants into the study. So whether you've had prior biologic therapy or whether you've not had prior biologic therapy, you will be eligible for this clinical trial, and we'll be examining that outcome as well in both those patient groups to determine the optimal treatment period for each one of those treatment groups, and then as we move forward, how we'll actually treat each of those treatment groups. Just as a reminder, as we're waiting for any other questions to come in, if you're interested in getting more information about the clinical trial or at filling out the questionnaire for the clinical trial, you can go to, you can email at cdtrial@qibd.com, or you could phone Andrea at 1-877-223-8637. You can go to our Restore Trial website and Facebook page, and at the website, qibd.com, you'll actually see the questionnaire in which you can complete and ascertain both your interest as well as some basic background information about your eligibility to participate in the trial. Those that complete the questionnaire will be followed up. Andrea will follow up with you to get some additional information, answer any questions you may have about this, about participating in a clinical trial or about participating in this clinical trial in particular. So we've had another question come in. Will you do any testing for aggregative invasive E. coli or paratuberculosis before or during the trial to see if different subsets of Crohn's patients respond to QBECO? That's a really good question. We will be looking at numerous biological markers. We will be looking at the microbiome, and we'll be looking to see from this information if we can determine if there are any groups of patients that do respond better, that do respond differently, and it'll be an important part of the evaluation process in this clinical trial is to try and determine how and when study participants actually respond to the medication. So we will look at some of those parameters that was asked in the question, but we'll also look at other parameters that may help us understand better how we can move forward with this program and in which patients may respond better to our treatment. So there's a question about, is it a belief that the previous trial treatment duration should have been longer for longer remission? That's a good question. The previous clinical trials that we had done were really designed to determine whether we could, or what percentage of patients would actually enter a remission or enter a response. And we were successful at determining that. We did see some of the data that that I showed, I think, on one of the earlier slides, that showed that we did get response rates at week 8, but we also had data that showed that patients that had been treated longer for out to week 16 continued to respond. So that is something that we did see in the previous clinical trial and that we will evaluate in this next coming clinical trial as well to determine if longer treatment will lead to more patients having symptom relief or into improving their mucosal integrity during the course of the treatment. There's a question about, I do take cannabis. I'm also okay with, is the Canadian 20-person open label trial still closed to U.S. citizens? As of right now, it is. We're actually only enrolling at Canadian sites, Canadian participants, and that's mostly having to do with insurance and other issues related to insurance. So I think we've actually gone through all of the questions. I would like to thank everybody for their participation, and I'll turn it back over to Bonnie to wrap up the webinar today.
Thank you so much for taking the time to join us for QBiologics webinar about an upcoming Crohn's disease clinical trial. We really appreciate all your great questions. A special thanks to our guests, Christine, Patrick, and Andrea, for joining us today. You can always find more information on our website, qibd.com, or restoretrial.ca. There's a link to the recording. That's where a link to the recording will be posted probably by next week. So this webinar has been recorded and will be posted. If you'd like to know more, or if you'd like to sign up to participate in the trial, your first step will be to complete our online screening questionnaire at www.restoretrial.ca. After that, Andrea will be able to start guiding you through the clinical trial process, and if you're a likely candidate, refer you to a trial site. Remember to follow us on social media, like us on Facebook, QIBD, follow us on Twitter at QCrohnsTrial. Thanks so much for joining us today, and stay tuned for upcoming news and events.